Australia is on to COVID vaccine number 5 for those of you keeping up with the government recommendations. They will now give this to anyone who has not had a vaccine within the last 6 months. So they're saying get these 6 months apart, or if you have not had COVID in that time frame. So if you did get a COVID diagnosis, they make you wait 6 months from your recovery, at least. You know, they're taking into account then your natural immunity, which is interesting because new research shows that the bivalent boosters are less effective against XBB.1.5, and we're going to get to that in a minute. But the Australian Health Minister, Mark Butler, said this about this new requirement. The vaccine booster advice from ATAGI is specific to the current Australian context in early of 2023. For this booster dose, all available COVID-19 vaccines are anticipated to provide a benefit. However, Omicron-specific mRNA booster vaccines are preferred over other vaccines. So that's a little confusing. You can get any COVID booster available. They're not picky, but they prefer the Omicron booster. That doesn't seem very solid advice.
It's kind of haphazard.
Just get whatever.
Just grab whatever you want.
It's like vaccine bingo. Like, okay, who's got the Omicron variant? We got Omicron variant. Like, who's got the Delta? You know, like
bivalent booster.
Just get one of them.
Yeah. Now, Australia is not. This is interesting. They're not at all authorizing these for anyone under 18 because they are acknowledging that this age group is not at high risk. I did, in fact, sort of glance through the Twitter replies to this Mark Butler, and there were a few people who are saying, why can't we get this for 5-year-olds? And I'm like, because read. That's why. Read a little bit about that. Now, Australia will roll out this 5th booster, even though news reports are that nearly a 1/5 of Australia's COVID vaccine stock was binned. That's the word for thrown in the trash, amid warnings of a fresh wave of cases. So this is showing that the country threw out almost 20% of its COVID vaccines last fall because they expired, because people just didn't want them. They just sat there until their expiration dates. Only 40% of the population had a 4th booster, compared to 95% of the Australian population that had the first full dose. So you can see demand really waning. That's less than half that got their first full dosage of the COVID vaccine. But that won't stop the government from buying up the vaccines, clearly. Butler said that Australia already has 4 million Omicron boosters and has ordered 10 million more. The pharmaceuticals don't care if they end up in the trash or not because they're paid for.
Right. They're already paid. We don't care if you throw them out or not. It doesn't really matter.
Who cares what you do with them?
Right.
Now about these bivalent boosters. A new study shows that they do not provide lasting immunity and are especially ineffective to the XBB.1.5 variant. This study was published in January, but it is still awaiting peer review. But it features researchers from Harvard Center for Virology and Vaccine Research, as well as researchers from Beth Israel Deaconess Medical Center in Boston. Here's the title page of the study in case you want to find it yourself. I always like to give you the title page in case you want to just go Google it and share it with your friends. Because
waning immunity, it's called.
Waning immunity against XBB.1.5 following bivalent mRNA boosters. Because I do know that a lot of you watch this show and then you repeat some of this to your friends and you need links at the ready to prove that we're not talking nonsense. I see you. I get it. So here is the title page, and here is the abstract telling us that what they did was test antibodies for people who received the bivalent boosters and found that their levels of antibodies were about what they were either before the booster or within just 3 months. You see the conclusion there. By month 3, these markers declined essentially to baseline levels prior to boosting. And so, okay, that's interesting. Does that mean that then we will need boosters every 3 months if the CDC gets its hands on this? Here is what one of the head researchers told to the Epoch Times, says this data suggests that once-a-year boosters with the current mRNA vaccines may not provide adequate protection for an entire year for those at high risk of complications of COVID-19. So this follows many other such studies that we have reported here, such as studies out of China showing that XBB.1.5 can evade protection. claims out of New York, the Public Health Center of New York City, showing that people who are vaccinated may actually be more likely to contract COVID. We covered both of those when they came out. So it's interesting that we're showing the lack of efficacy of this vaccine, yet more vaccines. And my worry is that the CDC will say, oh, vaccines wane after 3 months. Now we don't just need them once a year. Now we don't need them just every 6 months. We better just be taking them every 3 months.
Every 3 months.
Because the immunity is not sticking around, even though we know that XBB.1.5 is the dominant variant that's circulating on the globe, and that the bivalent booster is for BA4 and BA5. So that's not even that same strain. But sure, go ahead, Australia, order 10 million more. Why not? You get a booster, you get a booster. Like, just use up the taxpayer money. Get them.
And Australia, of course, has been really clamping down on free speech, censorship, and has been one of the most active countries around suppression of information and data around this. You know, and you have in the United States today this Twitter hearing. You had Nancy Mace, Representative Nancy Mace, who admitted during congressional testimony, she's a member of Congress. She said after taking the vaccine, she admitted that she now has asthma and she has like chronic pain as a result. And she said, you know, to be able to talk about this on social media, we were suppressed. You were not allowed to talk about this. You were blocked, you were banned, you were suppressed. And it could have prevented other people from having the same pain. Yeah. Same experience if we were allowed to talk about it and share it. Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern Time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.